For successful professionals and thriving business owners, achieving financial freedom is often a journey that's meticulously mapped out with investment strategy, tax optimization, and legacy planning. You're not in retirement yet, but you're wisely looking ahead towards it. However, an oftentimes less talked about yet potentially devastating financial drain often lurks in the shadows, and this has the power to unravel even the best laid plans. This is how healthcare costs impact your retirement. These expenses, which are vital for ensuring the longevity to enjoy your carefully crafted plans, can be both unpredictable and substantial. This presents a unique challenge to your long-term financial goals and overall peace of mind. You've dedicated years to building wealth with diligence and foresight. Our objective now is to ensure that medical expenses, whether they're anticipated or a sudden surprise, never compromise your ability to grow your assets or secure your family's future when you do reach retirement. With proactive planning for healthcare costs in retirement, these potential drains can be effectively managed, becoming a predictable component of your comprehensive financial picture rather than an unexpected sanity-gutting threat to your future. As a financial advisor specializing in integrating healthcare cost planning into a broader financial strategy for clients like you who are actively planning for retirement, I've compiled 8 practical approaches. This guide will help you confidently manage these potential expenses now, keeping your financial progress steady and your future wealth secure. What I hope your takeaways from this will be is a better understanding of your current medical spending, how to better plan ahead for expenses when possible, how to make sure your health plan works for you and your family, taking full advantage of your healthcare benefits, comparison shopping to make sure that medical services align with your goals and objectives, maximizing your HSA or FSA contributions, and consider medical expense tax deductions while exploring long-term care insurance as well. Effective management of future healthcare needs begins with clear data. Take stock of your current healthcare expenses to identify where your money is going. Reviewing past bills, bank statements, or patient portals can provide a comprehensive overview of your medical spending habits. This baseline is critical when you're planning for healthcare costs in retirement. Some key data to collect are items such as monthly healthcare insurance premiums, copays and coinsurance costs, prescription costs, vision and dental expenses, and over-the-counter drugs and medical devices. While medical emergencies are unforeseen, many healthcare costs can be planned for well in advance. Treating these expenses as a predictable part of your financial landscape allows for strategic preparation, safeguarding your retirement savings from medical costs. Some items to consider are ongoing medical treatments for chronic conditions, maternity expenses or costs related to family expansion, elective procedures, and genetic or hereditary conditions that will need to be addressed at some point in your life. Considering your family's health needs with a long-term perspective can help determine appropriate coverage and potential savings. Establishing a dedicated fund, such as an HSA, FSA, or even a cash reserve, can ensure you're prepared without impacting your long-term strategy or incurring debts as you save for your healthcare and retirement. It's a common misconception that more expensive healthcare coverage automatically equates to the best value, especially when planning for healthcare costs in retirement. Periodically assessing your health plan is crucial to ensure it aligns with your actual usage and your long-term financial objectives. Are you paying for benefits you rarely utilize, or are your out-of-pocket costs becoming a burden? Low-deductible health plans are plans that typically feature higher monthly premiums, but lower out-of-pocket costs for medical services. They may be suitable for individuals with chronic health conditions or regular medical needs, providing immediate financial predictability. Contrary to that, high-deductible health plans are characterized by lower monthly premiums and higher deductibles. These plans offer eligibility for health savings accounts, which offers a significant tax advantage for saving for future medical expenses. High-deductible health plans can be an effective choice for healthy individuals with fewer anticipated medical expenses, particularly those focused on building a substantial HSA for retirement planning. For many of my clients, a high-deductible health plan combined with a health savings account proves to be a fiscally sound strategy. The blend of lower premiums and a tax-advantaged savings vehicle for future medical costs offer both immediate and long-term benefits, helping you to fortify your retirement planning against medical costs. Health plans often include more than just coverage for illness or injury. Utilizing preventative care and wellness programs now can lead to both health improvements and financial savings by addressing issues before they become more complex or expensive, thereby reducing medical expenses in retirement. Annual physicals and routine screenings are an investment in your long-term health, helping to prevent more significant health issues down the road. Many plans also offer mental health services, fitness discounts, and wellness initiatives. These contribute to your overall well-being and potentially reduce your future healthcare needs. A little bit further on this, if a claim is denied, investigate it. Errors do occur, people are human, and a simple inquiry can often resolve coverage issues, saving you from unnecessary expenses. It's a small effort now that can yield a tangible financial return later, protecting your retirement savings from unnecessary medical costs. When you can plan ahead for medical expenses, use the time to shop around for better pricing. Collaborate with your primary healthcare provider and insurer to obtain accurate cost estimates. Compare costs for prescriptions, procedures, and medical appointments without sacrificing the quality, of course. Generic medications, for instance, are often a cost-effective alternative to brand-name drugs, helping you to stretch your healthcare budget as you plan for healthcare costs in your retirement years. If eligible through a high-deductible healthcare plan, a health savings account, more commonly referred to as an HSA, is an invaluable tool for saving for healthcare and retirement. Similarly, flexible spending accounts, more commonly referred to as FSAs, if offered by your employer, can provide a significant tax advantage for common medical expenses such as copays, dental work, prescriptions, and vision care. These accounts are crucial for optimally planning for medical expenses. Be aware, however, that there is a variation in utility between an HSA and an FSA, especially regarding their long-term potential for retirement planning. HSAs offer a triple tax advantage. They offer pre-tax contributions, tax-free growth, and tax-free withdrawals for qualified medical expenses. This translates into substantial tax efficiency for your healthcare spending. These accounts can accumulate value year after year and are portable, meaning they're not tied to a specific employer, making them ideal for long-term medical expenses and retirement savings. FSAs are similarly funded with pre-tax dollars. However, these accounts typically operate on a use it or lose it basis within the plan year, though some employers offer limited grace periods. This account is employer-sponsored, meaning if you're to leave your employer, any funds in the account are forfeited. While useful for current expenses, they lack the long-term retirement savings benefits of an HSA. To expand a little bit further, beyond immediate expenses, an HSA can serve as a potent long-term savings vehicle. Funds roll over annually and can be invested, growing tax-free as well. Consider the possibility of covering future medical needs in retirement with an account that is compounded tax-free for decades. This is a powerful component of a comprehensive financial planning for healthcare and a key strategy to mitigate how healthcare costs can impact your retirement plan. For years with unusually high medical expenditures, you may be eligible for a tax deduction. If you're qualified, unreimbursed medical expenses exceed 7.5% of your adjusted gross income and you itemize your deductions, this can provide notable tax relief, helping to alleviate the burden of a significant medical expense on your retirement savings. Some eligible expenses can include fees for doctors, specialists, and mental health professionals, inpatient hospital care, prescription medications, as well as a laundry list of others. The IRS has a complete list of medical expenses which are eligible for deducting on their website, which I have linked in the full article. While Medicare provides crucial support once you reach retirement, its coverage for long-term care needs, such as in-home care, assisted living, or nursing facilities, is limited. Long-term care insurance fills this crucial gap, helping to protect your accumulated assets and ensuring that future care costs do not erode your legacy plans or retirement savings. Exploring this option earlier can lead to more favorable premiums. For example, acquiring a policy in your 40s when you're in good health typically results in lower costs than waiting until later in life when healthcare issues may arise. This proactive step is a key part of planning for your healthcare costs in retirement and securing your financial future. Even with saying all of this, managing healthcare costs doesn't have to be a source of stress as you plan for retirement. As part of your holistic financial plan, we can help you strategically address these expenses. Our objective is to ensure that medical costs are a managed component of your financial journey, allowing you to focus on achieving financial freedom and securing the legacy you envision for you and your family.